Hello again. Welcome back. This is my recovery. Today I'm gonna go I'm gonna go over the OORMs, which we talked about before, which is the opioid overdose reversal medications. The papers I have here, if you see me, got my hands here. The papers here. They're from the SAMHSA overdose prevention toolkit that I've read from before when we went over how to help somebody that's ODing and what to do. So this is, like I said, the same from the same toolkit. I told you before I'd like to go over more that's in it, and I'm pretty sure that we ain't went over exactly what naloxone does and what it is, and they also have a new one on here, which is the Nalmefene. Nalmefene. So, without further ado, here we go. There's a role of OORMs. Because OORMs are life-saving medications that reverse the effects of an acute opioid overdose and restore breathing. They are available to the public by prescription, through standing orders, or without a prescription, over the counter at pharmacies and other retail outlets, or at no charge from local community-based organizations. Training is typically not required to obtain OORM, and when widely offered and used, OORM can reduce overdose fatality rates. The most known and used OORM is naloxone. Naloxone is FDA approved and has been used for decades by EMS providers and lay people to reverse opioid overdose and resuscitate individuals who have experienced an overdose involving opioids. There are two primary ways naloxone can be administered. It can be given intranasally through a device that sprays the medication into the person's nose. It is also available as an injection into a person's muscle, typically the butt, shoulder, or thigh. Different FDA-approved naloxone products are available in different doses. Products may come in kits compiled by harm reduction or other community organizations, which may include 2 doses of the medication, syringes for administering intramuscular naloxone if the medication is to be injected, gloves, a plastic face shield to support rescue breathing, and information on local resources. These harm reduction organization provided kits have not been reviewed or approved by FDA. And they're usually done by nonprofits anyway, so that's why they're not approved by FDA. Another FDA-approved OORM is Nalmefene. This medication reverses the effects of opioids and can treat symptoms of an acute overdose. It remains in the body for significantly longer than naloxone, with a half-life of 11 hours compared to naloxone's half-life of 1.5 to 2 hours. Wow, yeah, definitely longer. Research has shown that this longer half-life can lead to extended withdrawal symptoms in people who are tolerant on opioids. However, how this affects a real-world overdose is unknown. Injectable Nalmefene was approved by FDA in 1995. However, Nalmefene nasal spray was only recently approved in 2023 and does not yet have the same extensive field experience as naloxone. Please note, everyone should keep an OORM on hand, but especially those who use opioids or other drugs or have friends or family members who use opiates or other drugs. If someone is having a medical emergency that is not an opioid overdose, such as a heart attack or diabetic coma, giving them naloxone and nalmefene will generally not have any effect or cause them additional harm. Brief education on how to administer naloxone can be obtained from the provider of the naloxone kit or online at prescribetoprevent.org or getnaloxonenow.org. Speak with your pharmacist or harm reduction provider to understand the products available to you and any training considerations. Over-the-counter naloxone products have directions for use on the drug facts label of the product. And then it goes over the different types of OORMs that are available to the public. Most of them are naloxone. It comes in different brands like Revive, Narcan, generic, Zimha, and Cloaxdo. Man, I swear, they do medical names. I don't know why they can't do nothing that people know how to pronounce. You know what I'm saying? Says naloxone NA, which is the brand, non-typical. Man, I can't speak today. Adaptable nasal spray, 2 milligrams / milliliters. Says availability RX community naloxone dissemination harm reduction organizations. Consideration assembly required to attach nasal spray adapter to needleless syringe. Not approved by FDA. Possible to titrate to meet the needs of the patient and facilitate a gentler overdose reversal with potential for less severe withdrawal in people with opioids in their body. I'm just going to go over this, and I ain't going to read all these. It just says it comes also in a single-use nasal spray with 2 different dosages, 3 milligrams and 4 milligrams. A single dose of vial intramuscular injection can also be given intravenously or subcutaneously. That's at 0.4 milligrams, and they also have the another intramuscular, which is at 5 milligrams. Another single-use nasal spray at 8 milligrams, and then we also have the Nalmefene, which is by the brand OPB. It's a single-use nasal spray, 2.7 milligrams. If you want to read the rest of them, the considerations and everything, you can download, like I said, go ahead and download that toolkit, and like it has, sorry, can you see that? Anyway, I probably can't see it. Now can you see it? Well, that way you can stop the video and look at it maybe, and because it has the considerations over here, which tells you about if it's a lower dose or not, if it's longer lasting or not, and I mean just basic considerations whenever you use it, and what it's going to do to the body. The most important part, what I really want to get to, is below it, which is the Q&A. It says, is any naloxone better than no naloxone? It says yes. In the event of an overdose, administer any naloxone available. When stored under appropriate conditions, the shelf life of naloxone is 18 to 24 months for injectables and 36 to 48 months for a nasal spray. It is important to check the expiration date of naloxone and replace it at regular intervals. However, studies show naloxone stability remains at a usable standard even after multiple years of storage. While it may become less effective over time, research indicates that it does not cause harm if used past this expiration date. No research is available yet on the long-term shelf life of Nalmefene. And let's see, can naloxone treat any overdose? All OORMs are effective in reversing opioid overdose, including overdose caused by fentanyl. OORMs can be used in both youth and adult populations to reverse opioid-involved overdose. Use naloxone even if you are not sure what drug someone took. OORM may be less effective if someone has used multiple different drugs, especially those that also have a sedating effect on the body, such as alcohol or benzos. And it says xylazine, an active ingredient in a sedative approved by the FDA for use in animals but not humans, is increasingly being mixed into the unregulated drug supply. These drugs may make overdose reversal even more challenging. If the person is still unresponsive after the first dose, a second dose can be administered. Wait 2 to 3 minutes before giving a second dose of naloxone. Where can I get an OORM? Naloxone is available in all 50 states, territories, and tribal nations and communities. Ask your doctor, pharmacist, or other medical provider about naloxone, especially if you or someone you know is using opioids. Narcan in the 4 milligram nasal spray is now available for purchase over the counter in certain retail outlets, with other products becoming available over the counter. An example, Revive 3 milligram naloxone nasal spray. There are multiple options to obtain an OORM at no charge. Ask your local health department for more information or visit a harm reduction program. Many state and local health departments and behavioral health agencies now offer naloxone in public places through a vending machine, street outreach, at fairs and festivals, or other local events. Some programs even offer naloxone delivery by mail or will deliver it to you. Keep an eye out for a Nalox box, an emergency naloxone kit that can sometimes be found alongside public defibrillators. And it says there are so many kinds of OORM. How do I decide which one to get? Preference for an OORM is individual and can depend on familiarity with and accessibility of different products, which varies by program or pharmacy retail outlet. The major difference between each product is the strength, concentration, cost, and how it's administered. When presented with options, consider 1. All OORM have been approved by the FDA to reverse opioid overdose. They all act quickly to reverse an overdose and restore breathing, and there is no difference in effectiveness between a nasal spray and a muscular injection. 2. The higher the dose, the more likely and more severely someone who has developed tolerance to opioids will experience symptoms of withdrawal upon awakening. Withdrawal symptoms are flu-like and can include muscle pain, sweating, gastrointestinal distress, and heightened anxiety. Wow, okay, they really glossed over those, didn't they? A person who responds to a low dose of naloxone will typically wake up slowly and gently, similar to coming out of anesthesia after surgery. More naloxone can always be administered if needed. 3. If you are comfortable using a needle and syringe, learn how to use intramuscular naloxone. It is significantly more affordable than nasal spray products and provides the standard dose used by EMS providers. It is important to note that people who use drugs are those who both experience overdose and also witness and reverse the most overdoses. Experiences of withdrawal, particularly when severe, can be traumatic and may result in people who use drugs avoiding or leaving medical care settings due to their withdrawal symptoms. As a result, it is critical for decision makers and organizations that work in this area to support choice and interest in particular products when purchasing and distributing OORM. The next question is, do I need to give more naloxone for a fentanyl overdose? Giving more than one dose of naloxone and using higher dose products may not be necessary when responding to a known fentanyl overdose. An overdose may appear to need additional doses if other sedating drugs are present in the person's body, such as alcohol, benzos, or xylazine. However, rapidly giving more naloxone or using a stronger, more concentrated OORM will not necessarily speed up the reversal process. Multiple studies have found that despite the presence of fentanyl, more doses were not associated with improved outcomes. I brought that up in an earlier video. Administering a second dose too quickly after the first dose of an OORM may make it appear that multiple doses were needed. However, in some cases, waiting 2 to 3 minutes before administering a second dose and ensuring that effective rescue breaths are being provided would have been sufficient to reverse the overdose. Taking time to consider the effects of putting someone into withdrawal is compassionate and potentially life-saving. Extreme experiences of withdrawal can be painful, dangerous, and traumatizing, leading to negative feelings towards naloxone and people who use it. Fear of withdrawal may prevent someone from seeking needed care or hiding their drug use to avoid having naloxone administered. That's pretty much all the paperwork. I do have some sayings on this on the last part of this. What I want to say is I'm glad that it went back to withdrawal sayings. It's saying that it's painful, dangerous, and traumatizing. I love that they repeated it several times because when they first brought it up over here, it really surprised me how they glossed over the actual. I mean, they pretty much put everything underneath flu-like. I mean, you're going to be, yeah, there's definitely muscle pain. I mean, there's going to be a lot of shaking. I mean, I've seen people puke. I've seen people seizure. I've seen people, I mean, just not be, they're definitely not going to be in their right head. Sometimes they're going to be angry when they come out of their overdose. I mean, and they're going to be painful. It's going to be hurting, and they're going to have slight idea what happened to them. They're going to think they came out not like I did. They're going to think they came out from being asleep, and they're going to want to know why there's somebody over top of them, why you're giving them this medicine, and they're not going to believe you. They're not going to believe you. So, but that's not the point, right? I mean, it's not. It's to save their life. It has nothing to do with whether you're friends with them or not. I mean, I would still do it to my enemy, right? I mean, so it's just all that matters is the fact that you're saving their life, because even if they don't believe it, their life should mean more to them. And in most addicts, they don't believe that. They might say they do, but in all honesty, I mean, that's how you break the cycle of addiction, is you learn how to love yourself. I mean, and because if you love yourself, I mean, you're not going to want to stick needles in it. You're not going to want to stick a straw up your nose and snort pills. You're not going to need any drug whatsoever in order to enhance you, in order to cover up any problems you have. So, let's see. There was something else I wanted to say on here. Let's see, what was it? I've met people. I know what I want to say. It says, the fear of withdrawal may prevent someone from seeking needed care or hiding their drug use to avoid having naloxone administered. I know people who have freaked out so bad from having naloxone administered to them that it would scare the person who gave them the naloxone to never do it again. Like they would never do it again. And I mean, I've seen this happen. I know for a fact that it happens. Where I used to taxi people, I mean, I wasn't obviously the only one, but I mean, I've been left on the side of the road before. So I mean, like I know it happens all the time, and it's crazy, but people get scared. They get scared, and this right here just adds another layer of responsibility on top of a person that's already trying to run away from theirs, right? Because that's what addicts do. That's what we do. That's what we're good at, is run away from responsibilities. So the point of this is that if you know anybody that's doing opiates, if you know anybody that's doing drugs, period, okay, try to get you some of this stuff. And because it doesn't hurt at all if you do it to somebody that, if you don't know if they did opiates or not, but you know they're ODing, you think they're ODing, give them the stuff. I mean, right? And because most likely they are ODing off of opiates, because usually that's what they're ODing. It's usually what they're ODing off of. It's very rare that I've seen people OD off of anything else. So it's usually because of opiates that they're ODing. And so get this stuff, save a person's life, and keep it on you. I mean, put it in your purse, put it in your car, put it in your house, put it everywhere you possibly can. You know, especially if you're in areas like I am where drug use is pretty high. I mean, I would say probably 75% of the people around here use drugs, because we're such a poor community that, I mean, there's multiple effects why, but that's one of the reasons why. And so it's an outlet for them, and that's how they make money, right? So, anyways, get you some of this stuff, read the instructions on how to use it. It should be pretty self-explanatory, and hopefully you save a life with it. And I believe that's all for today.